For this presentation, I wanted to talk about the book And the Band Plays On, Politics, People, and the AIDS Epidemic, and its connection to medical humanities. So this book was originally published in 1987, and it is an investigative journalism, nonfiction work focused on the early years of the AIDS epidemic, and it focuses on the global response to it, with a main focus on the United States response, as it was one of the countries that had a large amount of early cases. This book was written by Randy Schultz, the first openly gay journalist for the San Francisco Chronicle, which gave him, at the time, a strong connection to the writing he was doing. He was, during the writing of this book, he actually contracted AIDS and eventually died from it in 1994. So as I said, this work focuses on the early years of the AIDS epidemic, focusing on the mid to late 1970s to the mid to late 1980s. It goes through the years month by month, using the stories and experiences of people working in the government, medical professionals, researchers, individuals suffering from AIDS, and their friends and families. The main themes seen through this book are just general governmental indifference and pushback. The president did not publicly acknowledge AIDS until 1985, when the first cases were being reported as early as 1981. There's just an overall, it was seen there was like an overall lack of funding and just a lot of bureaucracy occurring in the background. One example is in the naming rights of AIDS. There was a conflict between the United States and France, which prolonged the public acknowledgement of it. There are societal implications of, because many of the earlier cases were gay men and drug users, it was seen as a disease for undesirables, and therefore it was a punishment from God, which was also seen in illness as a metaphor. And it was seen as a gay problem or a drug user problem that would not affect the general world, so it wasn't treated as seriously. Hospitals would not treat patients who had the illness. There wasn't a lot of media coverage over it because they didn't want to sully the respectability of their publications. And then because of that lack of acknowledgement or media attention, there was just a lot of misinformation going around and just an overall poor public health response, where the government was not allowing media dispersal or accurate media dispersal. So how does this tie into the medical humanities? So throughout the book, it was seen a lot of unethical healthcare, where patients were treated poorly because of this diagnosis, or they just weren't looked at. So it really emphasizes what goes wrong when something like this happens and the importance of being ethical in healthcare. It shows an emphasis in needing better public health responses, and the responsibility in providing accurate information within those responses, because a lot of deaths could have been prevented had the public health response been greater. And then this book is just a really good way to demonstrate storytelling as a way to understand illness, because for me personally, I didn't know much about AIDS before this book, and just going through each person's personal narrative and seeing how this illness affected them personally, and then just seeing it on that small scale, and then a larger scale, and then a larger scale, and then making that connection to now and how other diseases and illnesses are seen. It's just a really good way to demonstrate how that illness impacts everybody and how we should understand it better. And then here is my We're Excited. Thank you.